Stop taking health advice from social media unless you watch this video. Today, I'm going to react to viral TikToks to tell you, is this legit or is this not legit? Howdy, Dr. Islam here, aka your poop guru and gut microbiome expert, board certified gastroenterologist trained at the Mayo Clinic. Been doing this for over 20 years, and every single day, patients ask me all sorts of questions on things they've seen on social media, TikTok, YouTube, everywhere. So today, we're gonna put these videos to the test to give you my opinion on the 4 most viral TikTok videos concerning your gut health. All right, let's go through the first TikTok here. Pocket Fennel for bloating. All right, let's see what this says.
Sushi was definitely the right call.
Yeah, but I'm bloated.
You're bloated? I got just the thing.
I'm scared. A little bit.
Oh, it's my pocket fennel.
Pocket fennel.
Pocket
It's
Fennel.
But all you do is just take some on your palm, like that, and down the hatch.
Oh, okay.
It's so easy.
I don't want it.
You don't want it?
No. I don't like the taste.
You don't like the taste of it?
Yeah, I mean, I'll just probably unbutton my pants or something.
You're still unbuttoning your pants and walk down the street like that.
All right, so Fennel. Actually, this is a great tip, and so I'm gonna give this like 2 poops up or 2 whatever up. But Fennel is fantastic, and we use this commonly for bloating. So did you know that Fennel's been around for centuries, and all sorts of cultures use Fennel for gut issues, whether it's Fennel tea, Fennel seeds like this TikTok is using, or anything along those lines. So what Fennel does actually helps to relax your stomach to make it easier when it comes to pain, bloating, distension. And for a lot of my patients that have bloating in particular, Fennel is a fantastic option to help minimize that bloating, especially if you ate something that causes a lot of bloating to occur. And so for a lot of my patients, I will recommend for them to use Fennel as an option to help minimize that bloating, minimize that pain, and help out when it comes to gut issues. So I'm very happy. Great tip. Love this. If you want to keep Pocket Fennel with you, that is fine. I actually don't like the taste of this. I don't think it tastes that great, but sometimes having Fennel tea may be an option as well. Other things we recommend that work really, really good. Peppermint oil, not oil that you put on your face, but peppermint tea or peppermint capsules work fantastic when it comes to abdominal pain and bloating. However, a big side effect can be heartburn or acid reflux. Mint tea can also help out with abdominal pain as well. Once again, another side effect from that is heartburn, acid reflux, and burning and burping up mint as well. Chamomile tea is also a fantastic option when it comes to gut issues. And surprisingly enough, spicy foods. Yes, did you know that eating a lot of spicy foods can actually make it easier when it comes to hemorrhoid issues, especially if you have that spicy butt? Yes, you have these nerve fibers in your bottom called capsaicin. These are nerve fibers that are triggered with a lot of spicy foods. And the more spicy foods that you have, kind of like a hell week that you want to have when it comes to spicy foods, the easier it's going to be to minimize that burning down below. So these are very natural options to hopefully help out when it comes to issues like that are very effective for your gut health. Now, surprising, Fennel actually has uses outside the gut. So, for example, dysmenorrhea or painful menses. Fennel also has abilities to relax uterine contractions by inhibiting what's called prostaglandin E2, which can also inhibit the contraction that occurs from painful menses. And then lastly, Fennel has also been used to help out with colic. Yes, when my wife was pregnant with our child, our first kid had terrible colic. It was bad. It was miserable. We tried all sorts of things. We actually ended up giving her Fennel tea. We actually baked that Fennel tea, put it in a little teapot, and gave her the milk from that. And this helped out tremendously when it came out with gut issues as well. So if you're having bloating, pain, distension, even painful menses, Fennel may be an option for you.
What is in this? What happened to me? What kind of stomachs do you all have out there? Come on! I took a spoon with this much.
Oh, that does not look like coconut cult. Why is it pink?
And I didn't have a number 1. I didn't have a number 2. I had a number 3 that was so bad. Explosive. I know this is going to be a little TMI, but what is in this? What? I did lose 3 pounds.
Yeah.
After my hour-long excursion on the porcelain throne. When I tell you I had to take a 20-minute shower, the hottest shower I've ever taken in my life, afterwards, this is what I'm going to be doing today. Pray for me and for my toilet. It tastes delicious. I could eat the whole thing. It's a little sour, a little coconutty. I love it, but it don't love me. Or maybe it loves me a little too much.
So when it comes to supplements like this, not everyone is going to respond the same. And that's okay. For some people who take coconut cut, they feel great. Their bloating goes away. It helps out with their gut microbiome. They feel better. But for others, it may cause explosive diarrhea, just like in this TikTok. So use your body as the best explanation or as the best guide for what's going on. Secondly, keep in mind, these products are not regulated. So I don't know what is in her version in the coconut cult, that those ingredients don't always correlate to what is actually in the product. This is a very problematic issue when it comes to these supplements that are not regulated. And this is a supplement that is not regulated. So make sure you get it from a particular manufacturer that is safe, that's known for quality, and it actually has the ingredients that matches what's in the product. Make sure it's third-party tested. Lastly, coconut cut has a lot of fat and can have a lot of sugar. So just because you have something healthy, or marketed as healthy, doesn't mean it's healthy for you. And so just keep that in mind. You actually may be more intolerant to that type of fat or that particular sugar itself. So just kind of keep that in mind. Overall, my biggest thing I want to give you in terms of takeaway is not every supplement is going to make you feel great. Not every supplement should be taken. And there are other higher priorities I would recommend instead, meaning manage your stress, manage your sleep, see if you have a food intolerance, try a low FODMAP diet, try to have more fruits and vegetables and fiber. Do these things that make a bigger difference than maybe adding small little cherry on top of that sundae by having coconut cult. If you don't do anything else, like if you sleep like crap, eat like crap, you drink like crap, you sleep like crap, you exercise like crap, you manage stress like crap, you're going to feel like crap no matter what type of supplement or coconut cult you're going to try. This is not the fix. It's not the cure-all. It may be one of those small 10% things that can make a small little difference, but doesn't fix the big things, which you can make a huge difference on when it comes to your gut health. Affecting the gut microbiome by eating right and having the right supplements, managing stress, the gut-brain axis, dealing with an actual medical condition, IBS, Crohn's, ulcerative colitis, managing sleep, and exercising. These are the big levers that make the biggest difference when it comes to improving your gut health.
Hey, just in case you didn't know, if you happen to get that parasite that we're seeing in the news right now, hypothetically, okay, you may have to, as a 27-year-old tax-paying home-owning adult, go to your local lab and shit in a cup. Yeah. You might have to look another adult in the eyes while you hand them a cup of your poop. So, just wanted you guys to know that. Not that I know from personal experience or anything.
All right, that's true. It sucks, but it's true. Unfortunately, the only way for us to diagnose cyclospora and a lot of the other infectious causes of diarrhea, including parasites, bacteria, and other things like that, is you have to poop in a cup. Yes, I know, it's inhuman. It sucks. It's not fun, especially in 2026, to have to be able to do that. Unfortunately, we have no other way to test for these particular infections. It's not like I can do a blood test on you and say, hey, you have an infection in your gut that's causing you to have diarrhea from a blood test from that. No, we can't do that. And so we work with what we got. And it's important for us to do these tests because these tests allow us to determine exactly what is going on. I know it's not fun. I know it's not something you want to do, but it's something we have to do. Us in the medical industry, we understand this. We're professionals. We deal with this all the time, whether you're a lab technician, whether you're going to a lab to give a specimen, whether you're a doctor, a nurse practitioner, a healthcare provider. We all know this. We understand that for us, this is a part of our job. It's a day-to-day occurrence. And so you may feel embarrassed that you have to do it, but I can almost guarantee you we don't feel embarrassed at all. We're not like, oh my gosh, that's disgusting. This person gave it to us. What are they doing? Why do they give us this stool specimen? No, this is our job, our everyday thing, so we're used to this. So I know it's hard to kind of get out of this mindset that, oh my gosh, I'm giving this guy a stool sample of my literal poo, or oh my gosh, I'm actually going to have somebody do a colonoscopy on me. It's so weird. It's our job, guys. It's what we do. We do this every day. It's not a big deal. Cyclospora is one of those diseases and one of those infections that we have to actually get the test to give you a diagnosis. We can't do this on just regular testing. And so by doing these stool testing, we actually find out what's going on and get you taken care of. And it's our job. It's what we want to do to make sure we get you the answers that you need to get you feeling better. All right, I don't call this desperation. I call this the perfect poo position. PPP. All right, I'm gonna hashtag that. Dr. Islam, poop guru, whatever. Perfect poo position. I want to tell you the perfect poo position. I want you to do this because I do this myself. Yes, you need to get your knees above your waist, whether it's a squatted potty, whether it is this person actually putting their feet on the toilet. It doesn't matter. You have to be that extreme, but you need to have your knees elevated for sure. Number 2, I want you to lean forward when you have a bowel movement. This is what I want you to do. Number 3, I want you to literally say the word moo. Yes, that expression of saying that word moo will allow you to have the breath that you need to have a bowel movement. Number 4, I don't want you to strain. I don't want you to push. And I don't want you to struggle. Number 5, if after 2 to 5 minutes you have not had a bowel movement, get up and go. Just get up and go. Have that rule. And then lastly, use a bidet to clean yourself and then dab yourself with toilet paper at the end. That is literally the perfect poo position, the perfect poo technique, the perfect poo everything. That's what I recommend to all my patients, and I recommend it for myself. So in this particular video, by elevating the legs above the waist, you are changing what's called the angle of your rectum and your sigmoid. Normally, your colon goes in a kind of a weird angle, and that sometimes can make it harder for stool to pass through. And for some people, that angle may be more changed or it may not relax appropriately. When you lift up the legs, it actually changes the angle to make it more into a slide. And poo can slide down. That's what we want. We want the sliding poo. We want the easy poo. We want the golden poo. And so, yes, use this angle. This may be an extreme example, but I think it's a perfect example of what I want to do to have that magic poo. All right, guys, these were my reactions to a lot of these TikTok videos. I like this, man, because I enjoy, bring some fun. It allows, changes the monotony of what I do, but also I can see what you guys are watching and see if it actually makes sense. So what I need from you is other things you want me to react to, other things you want me to react to, put in the comments down below. But also what I need from you is, do you like these reaction videos? Because I'll tell you, what we produce, what we make is directly determined by what you watch. So if you watch more of these videos and you give me more comments on this, I will do more of these videos. But if no one watches these, we get 0 views, well, then guess what? We're not going to do any of them again. Literally, you're the producer here, man. You tell us what to do. You tell us what you like. We'll do more of it. So let me know in the comments down below what you guys think. And if you're dealing with bloating, don't stop here. Click on the next video where I talk about 5 natural ways to de-bloat. These are simple, practical tips you can start today to improve your gut health. Thanks so much for watching. We'll see you guys in the next video.